palpitations may make you feel like your heart is beating too fast, has an irregular beat, feels like it's shaking strangely, or is pounding hard in your chest. You can imagine how many factors can cause these feelings. When palpitations are a concern depends on several factors. In fact, palpitations are usually not a sign that something dangerous is going on, but in some cases, heart palpitations can be cause for concern. So how do you know this palpitation is not a problem and this palpitation is a dangerous problem? What exactly is heart palpitations? In general, when we talk about palpitations, it means that you feel your heart beating and it feels like it is not normal. If you ask 4 people to explain the heartbeat, you will get a variety of answers. When people say, "I have palpitations," it can mean so many different things that you have to pay attention to the details of what they are saying to understand exactly what they are feeling. People often confuse normal heart activity with heart palpitations. Some people are very aware of what is happening in their body, they feel their heart beating faster and think it is a heartbeat, but in fact their heart is working at a normal rate of 100 beats per minute. The thing is, heart palpitations aren't what we think they are. If your thyroid is overactive, it produces a lot of thyroxine, which increases the body's metabolism. This can lead to a fast or irregular heartbeat, along with symptoms such as increased appetite and sudden weight loss. Why does heart palpitations occur? Your heart beats because it has an important job, which is to send blood full of oxygen and nutrients to all parts of the body. At the same time, the heart sends the carbon dioxide produced by the body, which is considered waste, to the lungs for you to eliminate. When something goes wrong in this system, you may experience palpitations. Your heart generally knows when to beat based on electrical impulses by a group of cells called the sinoatrial node. These cells are located in the right ventricle of your heart, also called the right atrium. If the sinoatrials begin to send weak electrical impulses, you may feel a palpitation. Common reasons that can give you palpitations. Most of the time when people feel palpitations, there is nothing wrong with their heart. There can be many reasons why your heart sends weak pulses, and most of these reasons are nothing to worry about. Heart palpitations are often caused by an increase in adrenaline or things that make the heart work harder than usual. Some common causes of palpitations include: you have consumed too much caffeine. Are you stressed? You have anxiety or a panic attack. You have a cold or flu. You lack sleep. You are taking a drug that contains stimulants. Are you doing or have you just done strenuous exercise? You are pregnant, which causes your blood volume to increase and your heart to have to beat harder to pump the extra blood. You have iron deficiency anemia. As you can see, many of these reasons are not dangerous and not worrying, and your heart is just doing its usual work and only you are aware of this normal activity. Sometimes palpitations can be a sign of a more serious problem. For example, these pulses become irregular due to arrhythmias, or irregular heartbeats, which are basically short circuits in your heart's electrical system. Arrhythmias can cause your heart to beat irregularly and feel unusual in your heart, possibly accompanied by weakness, dizziness, lightheadedness, fainting, shortness of breath, and chest pain, among other symptoms. Although arrhythmia is often not dangerous and can be treated in several ways, sometimes it can be dangerous. Only a doctor can tell you if your arrhythmia is serious, but any symptom in addition to an unusual feeling in your heart is usually an indication that your arrhythmia could be more serious. If you think you have any unusual symptoms associated with heart palpitations, see your doctor right away. Sometimes palpitations can indicate a problem in a different organ, for example, in the thyroid gland. Your thyroid produces hormones such as thyroxine and tretothyronine that affect many body systems. If your thyroid is overactive, it produces a lot of thyroxine, which increases the body's metabolism. This can lead to a fast or irregular heartbeat, along with symptoms such as increased appetite and sudden weight loss. You may also experience palpitations if you have a physical disorder, such as an enlarged or weak heart, which usually won't show up until you undergo some type of medical examination. When should you see a doctor about your heart palpitations? If you want to know when palpitations are worrisome and require medical attention, remember that most of the time it's not serious. A single heartbeat that lasts a few seconds and ends is a normal part of heart function. That is, if you experience it sometimes, there is nothing wrong with it. But if the palpitations are something that happens every time you do a certain activity, like walking or lifting something, it's not random and should be evaluated by a doctor. There are several symptoms and risk factors that you should pay attention to, because they can indicate a problem with your heart's function. If your heart palpitations are accompanied by any of the following symptoms, see a doctor. Confusion. Shortness of breath. Feeling unbalanced or unsteady. Fainting. Chest pain or discomfort. Medical history of any conditions involving the heart, such as heart disease. These symptoms require careful medical examinations to make sure that there is no dangerous case. So, if your heart palpitations are random and occasional and you have no other symptoms and your health is good, then your heart palpitations are not alarming. Of course, there is nothing wrong with it. To be sure, see a doctor for a medical examination. Your doctor can test your heart to make sure it's working properly. Prevention and treatment of heart palpitations. You don't need to do anything about your palpitations unless your doctor has determined that your palpitations are caused by a condition that needs treatment. That is, if for any reason you don't want to have heart palpitations so that the stress after that doesn't affect you in case there is a problem, the main thing you should do is to find the cause. Avoiding stimulants such as caffeine or using less of them, or managing your stress and anxiety by practicing deep breathing, exercising, or seeking help from a professional stress reliever may be what you need to do. Additionally, remember that most palpitations are not a cause for concern unless they are accompanied by other symptoms. You can trust your heart and what it is doing.